Hey, good afternoon. I'm Brandy Barrick, and welcome to Blue Cross Blue Shield of Louisiana's first ever episode of Keeping Up with Your Healthcare. Give us a thumbs up or a heart in the comments if you're watching. Feel free to share this on your social media site. And yeah, we want to have this reach as many people as we can. So feel free to share on Facebook if you're watching via Facebook. My name is Brandy Barrick. I am a registered nurse. I've been an RN in Louisiana for 14 years, and I've worked mostly in the hospital setting. I began with Blue Cross in 2018. Really enjoying my time here so far. And with me co-hosting today is Minnie Billings.
Hi, so my name is Minnie. I am a registered nurse here at Blue Cross and Blue Shield of Louisiana. Before my time here, I was a nurse. I worked at Women's Hospital in the adult ICU, and I was also an oncology nurse over there at the Baton Rouge General on Blue Bonnet. Before my nursing career, I've actually spent a lot of time in the hospital. Throughout college, I volunteered on the pediatric unit in the hospital, and also spent some time volunteering over at the St. Jude affiliate clinic over there. That's just so near and dear to my heart. I was actually diagnosed with ovarian cancer when I was 11 years old. So I just, I can recall all the different doctors and nurses and healthcare workers that have crossed my path. And I can just remember the compassion, the love, the empathy that they showed me through that dark time. And it really just stuck. And I hope that I'm able to just take an ounce of that and provide that to you, to your family members, to your friends, just anybody that you can think of that can use it. So Brandy and I, that's what we do here. We're a part of a care team of other nurses and doctors, registered dietitians, social workers. We're just here to help you find your strength in managing your chronic illnesses, such as high blood pressure, heart disease, diabetes, or even short-term instances, such as recovering from a car accident or cancer treatment, or even a high-risk pregnancy. So, if you do get a chance, definitely check us out on our social media pages. We have our Facebook group, that's Blue Cross and Blue Shield of Louisiana. The link is down below in the comments section. We also have a YouTube channel that has just so many educational resources, videos of our dietitians, shopping in the grocery store, information about COVID, just whatever it is about health, we've got it on there. So check it out. And thanks for taking the time out of your busy day just to join us. I hope you're able to just take an ounce of information from this. Feel free to drop any comments or any questions below in the comment section, and we'll try our best to answer those.
Thanks, Minnie. Yeah. So I just want to talk to you guys a little bit about our case management and disease management programs at Blue Cross and Blue Shield of Louisiana. So what we do is we talk to members on the telephone. We want to walk beside you through your journey with any chronic health condition or acute illness or injury. We want to help you be stronger than diabetes, stronger than cancer, stronger than heart disease, stronger than ever. You can visit our website at bcbsla.com/stronger. The link's in the comments. And you can reach out to us that way. You can also call customer service to speak to our nurses. That number is 800-317-2299. And it's not just nurses. It's a multidisciplinary team of social workers and dietitians and pharmacists and RNs and LPNs. There's a lot of us. Depending on your insurance group, sometimes also you qualify for discounts on medications. Also for speaking to us. Minnie?
Okay, so the first time you call in, what is something that you can expect? Well, if it's a nurse, you might talk to somebody like Brandy and I. So what we do is we'll go over your health history. We want to make sure that we can identify any barriers that may be preventing you from achieving that optimal health. We'll go over your medications, your treatment plans that might be in place set by your provider. We can work on goals that you feel is most important. You know, do you want to work on weight loss? I can't help you with the nutrition part, but that's when our registered dietitian comes in hand. So we can formulate a plan and I can hold you accountable. You know, would you like a follow-up call in a month? Would you like a follow-up call in 2 months? Are you having issues managing your medications? I can give you tips. I can help you with that. Ultimately, our goal is to help you understand your treatment plan and put you in touch with those resources to make sure we're doing our very best for you to achieve that optimal health status. We just want to make sure. I'm sorry.
So guys, what is a PCP? Does anybody know what a primary care doctor is? If you know what a PCP is, give me a thumbs up in the comments. And if you love your PCP, give us a heart in the comments. Shout out, I saw mine today, Dr. Michelle Selassie. She's awesome. We also have Quality Blue primary care doctors here at Blue Cross that we really rely on and work with often. Generally, a primary care doctor is going to be an internist, a family doctor, a geriatric specialist doctor, or a general practitioner for any adult, or a pediatrician for children. And so we encourage you every year to go and have your physical done. Though that's the yearly visit when you go and just let the doctor listen to you, check you out from head to toe, do a full assessment with a full set of labs. Most plans cover that. And it is very essential to keeping up with your health care. Those annual visits are super important, but also so are your preventative screenings, your mammogram, a female exam, a colonoscopy. Vaccines are not just for kids. We always try to remind folks that as kids go into college, most of the time it's important that they have, or the universities recommend that they have a meningococcal, sorry, and pneumonia vaccines for people that are over 65, an annual flu shot, or even a COVID vaccine. It's not just for kids. You can also have a shingles vaccine. Those are super important if you've ever had exposure to the chicken pox also. You can talk to your provider about your current health status or any concerns that you have, any conditions. I usually try to sit down and make a list with my members before their doctor's visits so that they can talk about all the things that they want to talk about when they're there, because the time with the doctor is sometimes short. Yeah, so Minnie?
So like Brandy said, I almost called you Bridget. I know who you are. So like Brandy said, kids as well as adults should be seen annually. We want you to sit down with your child's provider to discuss their overall health. Use this as an opportunity to make sure your child is reaching the age-appropriate developmental milestones. If it's been more than a year since your child has had a checkup, make an appointment. Summer is coming up and kids may be planning to attend camps or even start some new activities. So it's just a great time for a health check to see how they're doing. We've gotten national reports that record numbers of kids are behind on their routine immunizations. We don't want to try to get through this COVID-19 vaccine, or I'm sorry, this COVID-19 outbreak, and then all of a sudden have to deal with an outbreak of measles and mumps or any other illnesses that could have been prevented through routine childhood vaccines. We often think about vaccines as being for babies and toddlers, and there are a lot of vaccines for that age group, but there are other vaccines that children in middle school, high school, or even college need in order to stay on schedule. Vaccines like HPV, meningitis, or even the COVID-19 vaccine that's now available for kids 16 and up.
Definitely. Okay, so your annual visit is done for this year. And I feel like a lot of people are like, okay, now what? So you get a really brief time with your doctor, like I was saying earlier, but that's why it's good to prepare ahead of time, but also it kind of reinforcing those treatment plans, going through what's expected and what they're asking you to do between visits. I asked my primary care doctor, oh gosh, when I first became a nurse, what would be something that she wished that more people knew? And she told me that she wished that she could write a prescription for exercise. So I found most of the time that's a big discussion at a PCP wellness visit. And she said, you know, if I could just write a prescription for like 3 days a week to be physically active for 30 minutes, I would, and hopefully people would take it like they do their blood pressure pills or so forth, because that's important too. And she said, you know, that's just as important as those blood pressure pills. So those notes that come from the providers when we coordinate with your providers help us to reinforce the things that your doctor felt like was important. We also try to go through your medications on every call. We try to talk about what all you're taking and how it's going and what your side effects are and how well they're tolerated. I've had people tell me on the telephone that they have a terrible stomach ache from taking that pill, so they don't take that, but they didn't tell their doctor. So that may be why our numbers are still out of whack. So that you know, like, it's important to communicate that there may be something else that we can substitute that would make that more tolerable for you. No doctor wants to see you miserable, and definitely sharing that information with us is super helpful to us. Also, the other big thing about when we go through your medicines is we talk about cost and how affordable they are. Sometimes I've also had patients call me and talk to me, and as we're talking, they're like, oh, well, I only take half the amount of insulin I'm supposed to have, or I take that every other day because it's so expensive. So sometimes we have to kind of step back and reset and call the provider and say, hey, you know, the patient's not taking this because it's so expensive. Sometimes we're able to find a manufacturer's coupon or another coupon on GoodRx.com or something like that. But if that doesn't work out, there are a lot of times are alternatives that we can ask the doctor about. Like, would this be better? Can we use something from a $4 value prescription list at the drugstore, anything like that? Also, taking your medicine on time and remembering to take your medicine, we try to help with that also. Talking to people about pill boxes and sending educational information through email. We do try to educate you on what your side effects could be, or kind of connect the dots for you. A lot of times that comprehensive conversation doesn't really happen in the doctor's office because of time. Yeah, so.
All right, so give me some hearts, thumbs up if you love to shop or you like shopping. I love to shop, but I also love shopping smart. And if you ask any of my friends, they will tell you I'm your girl when it comes to finding the best deals. But did you know you can do the same with labs and tests ordered by your providers? Yes, you really can. So, say for example, your doctor orders an MRI for you. You can utilize our Smart Shopper at bsla.com/smart shopper. And what it is it'll help you locate some in-network providers and give you a quote as to how much those MRIs can cost at different facilities. You would be amazed as to how much money you can save. I personally have saved $150 doing an MRI, and it wasn't even across town. It was actually at a different facility right down the street from the original hospital that my doctors had sent their original orders to. So check them out. It is such a great resource. I mean, that's a ton of money that we can be spending elsewhere, eating healthier, spending money on groceries, or even that shirt you've been eyeing in the mall window. So yeah, definitely check it out at the link below.
Yeah. Okay. Well, that's awesome for sure. I like to save money for sure. To switch gears a little, I want to talk about the coronavirus, COVID-19, that everybody's been kind of the forefront of everybody's mind this last year. It's been a devastating pandemic. It's been a really hard year in the last 12 months. We just kind of want to reinforce that eligibility for those vaccines is open for everyone ages 16 and up. We have another live stream with a physician that is a lot of information about the 3 vaccines, and there are lots of questions and answers in that one. So I would definitely check that out. Let's see. And we just kind of want to reassure you that you're safe. They're safe, and we're working towards herd immunity, and people that can get it should. We highly encourage it because we want to try to protect people that can't protect themselves, because there are people that can't have this. Children, adults, older people on chemotherapy or immunosuppressant drugs can't have these vaccines sometimes for one reason or another. So it's important that we take care of our community that can't take care of themselves. You can visit the ldh.la.gov link below to check out where you can get one of those vaccines. And the vaccine hotline is 855-453-0774. You can call for assistance in scheduling your appointment or finding a vaccine site near you. Yeah, so we definitely want to see that everyone is working towards getting vaccinated.
So tell me, who all out there has gotten their vaccine? Give me a thumbs up, a like, a comment below. Let us know how you did. Did you have some terrible side effects? Was it easy breezy? We'd love to know. And we want to see your shot picture. So find us on social media and hashtag us. And if you're still hesitant about getting that COVID vaccine, make sure you are getting information that comes from a reliable source, like the Louisiana Department of Health or the CDC. There's just so much there's just so much rumors and misinformation flying around about the vaccine. We want you to sit down and, if you have any questions about your health condition that you think might be contraindicated with the COVID vaccine, sit down with your providers and talk to them. And if you don't have a primary care physician, you can call that 1-800 number on the back of your insurance card and talk to one of us. We'll help you find a provider. So get the facts and get the vax.
That's right. I just also wanted to add that we shouldn't hesitate to get the vaccine out of cost concerns. The federal government has authorized the ability for them to fund that based on the CARES Act. And most health plans are absorbing the cost of the administration. So there shouldn't be any out-of-pocket cost, very little to no out-of-pocket cost, I would say, on most plans. So, but also watching out for fraud is important, being very suspicious if you get a cold call or an outreach for someone trying to charge you for a vaccine or to charge you to up you on the list for priority scheduling or something like that. Unfortunately, there are always scammers that are going to take advantage of people in the midst of a crisis.
Yeah, definitely. Definitely. So watch out for that. But thank you. We are running short on time. Thank you so much for co-hosting with me, Brandy. And thank you for all those that have joined us today. I hope you were able to take something from you, from this broadcast. How are you feeling about the information we presented today? Do you feel like you learned something new? Is there anything that you want to learn about? Drop some comments below and let us, we'll definitely, look into that and see if we can do some future broadcasts on those topics.
I just noticed in the chat, Minnie, just a couple things I wanted to share. One of our commenters said to make sure to warn college-bound kids that their wellness visit before college may include labs. So she sent her kids without that warning, and they got stuck. They got stuck for labs. They weren't really prepared. She said it was their first step into adulting. So welcome to being an adult. Here's a shot for you, and we're gonna draw some blood.
Okay.
And our other question is, how long is a typical conversation that we have with our patients? So that is super varied depending on the patient and what's going on. I know sometimes our really well patients that are doing really well, they don't have any problems, and they're just kind of following up with us yearly or biannually to just continue to participate in our program. And we call just to pop in and say, hey, don't forget, we're here to support you. How are things going? And just to remind you about your wellness visits and your mammogram and all of those kind of things every year so that we can get those checked off the list. So the really simple calls may be 10 to 15 minutes. But to be honest, I've spent an hour on the phone with people before that were really struggling and had lots of questions, and or they had a complicated situation, or oh gosh, I'm just really depends on you. Like if you call and you say, hey, I want to talk during my 30-minute lunch, we'll accommodate that. But we need to know.
Okay, so there's another question. Can I call you if I get a report from my doctor's visits that I don't understand? Yes, of course. The only thing is that we might not always have what your treatment plan is, and the information that you have in front of you, we might not have in front of us. But we can try to work with your provider and request, those documents and see if we can all, come to an understanding and help you, with questions that you might have. I hope I answered your question there.
Yeah, we want to tell you about our upcoming live streams. On Wednesday, April 21st at noon, our medical directors, Dr. Emily Vincent and Dr. Tracy Lamel, the dynamic duo pair, we love them. They'll continue the conversation about the COVID vaccine. Things are changing rapidly and resources you should know about, such as free transportation options and the governor's helpline number in their direct from the doctors broadcast. They'll address your questions. Also, our registered dietitians will continue their series with Romaine Calm and Carrot On. Those are great. I've been personally referring people and sending links for these. They're continuing their trek through the grocery store. One of our local grocery stores has agreed to allow them to film there, and they're really going through and shopping with a mask on and social distancing and looking at real items in the freezer section and real items through produce. So just to help you make better choices at the grocery store. Monday, April 26th at 6 p.m., our candid conversation about COVID. We're partnering with 100 Black Men, and we'll have Dr. Max Madeir and our very own Paula Shepard. Shout out to him, to both of them. We're excited for that. And lastly, on Tuesday, April 27th at 10 a.m., we'll come to talk to you live about all the things you know about risks, fraud, and medication safety with Bryce Mahundro and Candace Cowart, our staff pharmacists at Blue Cross, both outstanding and very intelligent ladies that work with us every day. So we're excited for those. Make sure you RSVP for all these goodies and subscribe to our Blue Cross Facebook and our Blue Cross YouTube, and check us out and continue to join us. Thanks for listening today, and thanks, Minnie, for helping me co-host.
Thank you. And y'all don't forget to share this broadcast if you find that the information was good. Let us know what you think.
Thanks, you guys.
Thanks.
Have a good day.